Autumn Lake Healthcare is in the beautiful coastal town of Norwalk, Connecticut, and its behavioral health team provides services for over half of the 110 residents who currently reside there. The facility has been serving the community for the past 30 years by offering both long-term residential care for the elderly and subacute rehabilitation. Autumn Lake is a 5-star award-winning nursing center that is nestled between trees and gardens, and it is a tranquil place where residents experience healing, joy, and can live their best lives. The administrator is Megan Smith, a licensed master social worker, and she oversees the behavioral health team that services the residents. Many emotions come up for the patients new to the inpatient rehab services. Each person has a unique story that got them there, keeps them there for treatment, and waits for them upon discharge, and the behavioral health team gets to know these stories. Many emotions can feel unexpected for our long-term care residents as they settle in and make Autumn Lake their new home. It is common at first to experience a bit of anxiety or sadness. That is normal. It has also been shown that depression and anxiety increase with age. It is just a fact of life. Isolation due to illness and COVID-19 restrictions, or grief and withdrawal from the loss of a good friend or spouse can seem enormously hard for some individuals, and loneliness is commonly seen. Now, the behavioral health team assists residents with their mental health needs, including difficulty with life transitions, grief, loneliness, and mood disorders. They assist with those adjustment disorders related to recent medical decline requiring facility placement, and the management of other long-term conditions such as schizophrenia and bipolar disorder. They can provide individual counseling services as well as medication management. They typically have a psych provider in the facility 5 days a week, and the psych credentials include a psychologist, psychiatrist, licensed clinical social worker, and psychiatric advanced practice registered nurse. Autumn Lake contracts their behavioral health services out to Harvest Healthcare. Harvest Healthcare is a leading full-service mental health provider. They specialize in behavioral health for patients living in skilled nursing, rehabilitation, and assisted living facilities. By working with Harvest, Megan can always expand the program with the addition of increased services, and she has done just that. She shared that the facility used to have behavioral health services only 2 or 3 days a week. However, as Autumn Lake began to take younger patients, the team identified a need for a more robust psychiatric program. She was able to communicate this to Harvest, and they made adjustments to their services to meet the patient's increased mental health needs. In order to guide crucial client-centered decision-making, Megan and Autumn Lake's behavioral health professionals solicit feedback from 2 fundamental groups. In the first group, we find the people being cared for, the patients, residents, and their family members. They all have the opportunity to share with providers how things have been working for them. Such close communication makes it possible to provide in-the-moment care and adjustments if needed and meet the residents where they are. The second group whose input is sought consists of the people providing the care, and these folks are the frontline staff and managers and their collaborative community partners. It is their attitude towards collaboration and the way they welcome the community's mental health services that sets the behavioral health team at Autumn Lake apart from the rest. For example, to maintain continuity of care and minimal disruption for short-term rehab patients, they can target their mental health services to coordinate with community providers who may be treating the patient already. It would be a disservice to the new rehab patient if the care they received was wildly different from what they were used to. It is wise of this behavioral health team to find out what the patient is already comfortable with. Doing this, though, requires a dedication to communication to ensure that the patient's help before being admitted to rehab flows into the help they receive as a current patient, which then follows congruently back to their provider for ongoing outpatient mental health management. They also actively assist with facilitating telehealth visits between community mental health providers and the residents and patients. The strength of the behavioral health team that shows its aptitude the most is that care is specifically individualized. The team shows their skills by being able to meet and suit the mental health needs of both the 30 short-term rehab patients staying there and the 80 long-term care residents who call Autumn Lake their home. Megan sees the program growing in the future as the needs of the residents change. One area for growth is in individual counseling services. Although there are social workers on the behavioral health team, at this time the social workers do not provide direct counseling services to their short-term rehab patients or long-term care residents. Through mentoring interns, the behavioral health team expands their capabilities by supervising the one-on-one therapeutic relationships the interns develop. The biggest challenge they face, according to Megan, is not being able to have mental health providers in the facility 7 days a week. She is not entirely sure right now that it is necessary yet, and she continues to monitor her residents' needs. Should she feel they require additional services, she will let Harvest know and provide the extra help. Autumn Lake is a vibrant place with daily social activities available for residents to connect and enjoy themselves. This requires a staff that is dedicated at every level to their physical, spiritual, mental, and emotional well-being. So many good things go into making Autumn Lake a great choice. The fact that the behavioral health team is there to ensure the mental health needs of the patients and residents are being met, that makes it the perfect choice, particularly for individuals with behavioral health needs that they want assistance with while staying there.